I'm Dr. Stephen Iacoboni, medical oncologist and hematologist. And I've been here in Hermiston for the past 5 months, starting up a new program at Good Shepherd Hospital. And it's a real pleasure for me to be here. I just said that I've been here a short time, and in that sense I'm new to the community, but not entirely. I actually started out in this area almost 30 years ago. Let me tell you about that. So I started out as a professor of cancer at one of the top cancer centers in the world, MD Anderson in Houston. Maybe you've heard of it. And I found out rather quickly that I much preferred taking care of patients than doing research. And I also realized that the purpose of research centers is to do research. I wanted to mostly take care of patients. So I first moved back to my home in California and practiced there for a short time before deciding I really needed to get out into the country. And I became the first medical oncologist in Southeast, board certified medical oncologist in the entire region, including the Tri-Cities area and Umatilla, Morrow County, and Walla Walla and Columbia County. So I started and founded the Cancer Center in Walla Walla in 1989. Of course, there were other practicing physicians in Tri-Cities at the time, but we set up the St. Mary Regional Cancer Center at that time, and that was a real delight and a real pleasure and a real privilege. Duty sort of called for me to take my management and administrative skills to other places, and so I have been the medical director now of 3 cancer centers in the Northwest. And then beyond that, I reached a point in my life which many oncologists do, where you find something's missing. And I had to go searching. And I have been traveling for the past 6 years. And I've learned a lot. Some of that travel has been outside of the borders of the United States. And I've learned a lot in those journeys. And having done all that, I found a yearning to return to the inland Northwest. And I had actually been coming to Hermiston, going as far back as 1986, and have always been fond of the area. And when Good Shepherd decided to launch the program, I showed up, and we all decided to move ahead, and so here I am. One of the things that's not everybody understands about the practice of medicine is that it really is a practice. And occasionally you'll see a cartoon saying, "I want to see my doctor after he or she is done practicing." The reason is that what happens to you when you see a doctor depends on how that doctor decides to manage you. We have sort of created the illusion that it's like getting on a jet airplane, and that the pilot is simply going to follow the manual and get you from one runway to another. And the reason that analogy is sort of worth using is because when you're sitting in a jetliner at 30,000 feet, or when you're sitting in the exam room in an oncologist's office, in both cases, your life is on the line and you have very little control over what is going to happen to you. And so it's reassuring to think that every pilot is the same, and they go through rigorous training. But what really matters is when things go slightly off protocol, and the guy or the woman in the cockpit has to save your life. Of course, flying an airplane is pretty much still a matter of engineering and aeronautics. It's physics and engineering. Oncology is 100 times more complicated than that, because you're dealing, first of all, with biology, and beyond that, you're dealing with a person, and beyond that, you're dealing with a person with a soul and a spirit. And the challenge I have found in oncology is to learn all of the science, which is just biology and chemistry, and using all of that science, which never ever mentions the spirit or the soul, and then yet remembering that for every patient, they aren't a lab rat, and they're not a guinea pig, and they have a family and a life and a spiritual life, and all of that has to be recognized. And every single human being you've ever met in your life is different. I've even known identical twins. And in fact, one of them was a nurse of mine in Walla Walla, and she had a sister, and they were identical twins, and they both did everything they could to be as unlike each other as possible, both in looks and clothing and profession and personality. The thing to keep in mind, though, is that the care of cancer in the Western world is now the single most expensive and money-driven enterprise of all industries in the Western world, other than the military. So it's true, we don't have $120 million Raptors, but the total cost of chemotherapy alone in Europe and the United States and Canada and Australia every year approaches $1 trillion. Now, we live in the real world, and one has to acknowledge that when that amount of money is being used, there are forces behind it that have to regulate how that money is used. I don't want to get too far off on that. I just throw that out as something to keep in mind, that one of the things that the money situation has caused is that the people spending the money, meaning the third payers, and the insurance companies and so on, have an interest in making sure that that money is spent wisely, but at the same time not infringing on the autonomy of the patient and the doctor to make choices independent of that. Most of you may be aware of the fact that oncology and chemotherapy care in America is different than any other place in the world. So I worked for a while close to the Canadian border, and basically Canada, which is a very nice place, they have a different philosophy. You get so much chemo and then you're done, and if you want more, you have to go to the United States. And that's true basically everywhere except the United States. I mention that because one of the ways that the industry, the profession, is itself engineered and regulated is that each doctor has the authority to make treatment decisions, but you can't have, there are 15,000 oncologists in America. You can't have each of them going hither and yon, doing things, and having a chaotic system. And so the idea is to channel all of our behavior into what we call algorithms or pathways of care. And largely, the motivation for that is to make sure that we are doing things that are evidence-based and in the best interest of the patient. And there isn't anybody who disagrees that that is a very sensible approach. But let's get back to the jetliner analogy. Everyone agrees that the flaps on the jet have to be at a certain position for takeoff, and that the thrust has to be adequate to carry the load in the jetliner. And on a routine flight, you follow the guidelines and you land, and there aren't any problems. But it's just not how it always goes. And following the guidelines, it's important to understand that the guidelines are guidelines. And I don't know how long it takes to train someone to fly an aircraft, but it doesn't take the 20 years that I spent training, because cancer is very complicated and human medical care is very complicated. And the purpose of all of that is for the doctor who's taking care of you to be able to see what's going on, make adjustments, and whether there's a thunderstorm or a hurricane or you lose an engine, that you still get back on the ground safely. So I've had patients have heart attacks and blood clots and infections and psychological breakdown and fevers and all sorts of things that you can barely imagine go on during their care, and I have guided them safely back. That's the joy and the excitement of what we do. And then the other thing to keep in mind, if you ever watch any of these shows about air disasters and that sort of thing, is that if you watch the movie Sully, where the guy flew into the geese over the Hudson River, if you're sitting in the jet, you don't get a lot of personal attention. They just say, sit down, be quiet, tighten your seatbelt, and brace for impact. Well, of course, we could do that in the clinic, but we don't. We try and teach you each step of the way what's going on, where we're going, where we're headed, what we can do about it, what your options are. And I have always sort of been a person who's taken a certain amount of criticism because I spend a lot of time with my patients. I've talked to oncologists who see 30 patients a day in 6 hours. That means 10 minutes. If you've got a question, talk to the nurse or look it up or this or that. Get in the chemo chair, sit down, take your chemo. I'm sorry you have cancer, but I haven't got time for you right now. Well, I just don't find that acceptable. I also don't, it's just not how I like to deal with people. If you're hungry, you can go to McDonald's and you can spend $5 and get 1,000 calories and be nice and full. But you can also go somewhere else where they spent all day sautéing the veal and creating the sauce and have a meal of a lifetime. In each case, when you're done, you have the same molecules in your stomach, but the experience and the taste has been quite different. As far as I'm concerned, having done this for so long, literally for 40 years, the science of oncology, which is extremely complicated, to me is something I've understood for a long, long time, and it's not complicated to me. Now, it would take somebody coming out of medical school 20 years to know what I know, but that was for me 20 years ago. What's exciting and what's interesting is the spiritual connection between the doctor and the patient that occurs in every single visit. There's no such thing as a routine visit. There's no such thing as a routine cancer. There's no such thing as a routine case. Yesterday I saw a patient and she'd had a complication and she said to me, "Doctor, I feel like crying. I hope you don't find this too peculiar," but I started singing to her. And we started singing that song, "It's Crying Time Again." And she picked right up, and we sang the whole song together and held hands. And at the end, we were laughing, and we all know that that's therapeutic. No, it's not in an algorithm. No, it's not in a textbook. No, your professor probably hadn't told you that's a good idea. But if you understand that this is not just a matter of biology and chemistry, but a matter of spirituality, then you understand, of course, that's meaningful. We were not meant to live forever. You can ask Steve McQueen and Jackie Onassis and Steve Jobs. Well, you could ask them, but they're not here now. These are all rich and powerful people who had the best cancer care that money could buy at their disposal. What's important in life always is the journey, not when you get there. Arriving just means it's time for another journey. If you take a trip to Europe or Tahiti or the Colorado Rockies, it's the time you spent there that you cherish, and then when it's over with, you come home and you cherish it, but it's the experience that you had. There's an old samurai saying, maybe you've heard of it, the whole world in a blade of grass, an entire life in one breath. Every single second of your life is a miracle. And believe me, I have studied this down to the subatomic level, and science cannot explain how it is that you understand me when we sit here and talk. Science cannot create a computer that can love or care or calculate anything other than simple arithmetic. We are not machines. We will never be machines. And what we have to do is recognize and embrace that the biology and the chemistry that breathes oxygen into us and creates chemical energy is just there as the furnace to drive the engine of the life that is in our soul. Humans have known this from the time they climbed out of trees or from the time they walked out of the Garden of Eden, depending on how you see the ancient world that we can't know anything about except in retrospect. Every single culture of the human race from the beginning of time has recognized this. And the reason why I'm still working at my ripe old age, I'm only 55, is because of the beauty and the drama that happens every time I see a patient and every time I take care of them. It doesn't get old for me. The idea of burnout is not in my vocabulary. A physician understands that he or she is given a gift of healing, and there's no greater gift than that. And I will do it until I can't do it anymore. I think that's enough for now. I think you get to know me. I hope that what you've heard you've liked. We'll be talking again in the next episode, and I look forward to chatting with you at that time.